Hello everyone, this is Eagle News. I'm Ken Cruz in Washington. It's Saturday, July 23rd, 2022, here in the nation's capital. This week's recap begins now. The White House announced Thursday morning that U.S. President Joe Biden has tested positive for COVID-19. It said the 79-year-old is fully vaccinated and twice boosted and has begun taking the anti-COVID pill Paxlovid. Officials say Biden is experiencing very mild symptoms. He will work in isolation, and once he tests negative, he will return to in-person work. The U.S. leader went to social media to inform the public about his condition.
Hey folks, guess you heard this morning I tested positive for COVID. But I've been double vaccinated, double boosted. Symptoms are mild, and I really appreciate your inquiry and your concerns. But I'm doing well, I'm getting a lot of work done, I'm going to continue to get it done. And in the meantime, thanks for your concern and keep the faith. It's going to be okay.
Biden has been in contact with members of his staff and has attended scheduled meetings via phone or video conferencing. The White House says it will provide daily updates on the president's condition. 988 is the new 3-digit number to dial if you or someone you know is undergoing a mental health crisis. Jeff Sanidad tells us more.
988 is the new 3-digit lifeline for suicide and mental health crisis in the United States. All telephone service and text providers in the U.S. and the 5 major U.S. territories have been required by the FCC to activate 988 no later than July 16.
It is an unprecedented transformation and opportunity to transform how we think about and how we approach crisis care across the nation.
The Health and Human Service Department says 988 is more than just a number. It is a message saying, we are there for you. The 988 Suicide and Crisis Lifeline is a network of more than 200 state and local call centers supported by the HHS through the Substance Abuse and Mental Health Services Administration.
So when an individual calls, texts, or chats to access 988 services, they will be connected to a trained crisis counselor who will be able to provide support, to listen to what their concerns are, provide stabilization services, de-escalate the crisis, and then provide linkages and referrals to ongoing supports and services. We know that in most cases that contact alone can be life-saving and can be enough to provide stabilization for that individual in crisis.
In 2021, the Lifeline received 3.6 million calls, chats, and texts. The number is expected to at least double within the first full year after the 988 transition. According to the Centers for Disease Control and Prevention, the United States had 1 death by suicide every 11 minutes in 2021. Suicide was the second leading cause of death for young people aged 10 to 14 and 25 to 34. Studies have shown that after speaking with a trained crisis counselor, most Lifeline callers are significantly more likely to feel less depressed, less suicidal, less overwhelmed, and more hopeful. Jeff Sanidad, Washington, D.C., Eagle News. We live in extraordinary times.
In a report by the Centers for Disease Control and Prevention, the number of drug overdose deaths has alarmingly increased in 2020 among Blacks, American Indians, and Alaska Natives, Arlene Ocampo reports.
In its Vital Signs report, the Center for Disease Control and Prevention says that drug overdose deaths per 100,000 people have increased 44% for Blacks and 39% for American Indians and Alaska Natives compared with 2019. This is based on data from 25 states and the District of Columbia. The health agency says overdose death rates in other groups are also at historic highs. It cites the increase of drug overdose deaths for white people at 22%. The CDC says the COVID-19 pandemic has likely contributed to this growth in overdose deaths. It adds that recent increases in deaths have been largely driven by illicitly manufactured fentanyl and fentanyl analogs, or IMFs. Among the key findings for these historic overdose deaths in 2020 include the overdose death rate among Black males 65 years and older was nearly 7 times that of white males in the same age group. Black people 15 through 24 years old experienced the largest rate increase at 86%. Overdose death rates for American Indian and Alaska Native women 25 through 44 years of age were nearly 2 times that of their white counterparts. The CDC reminds the public that drug overdoses are preventable. It emphasizes that the growing overdose crisis, particularly among people from racial and ethnic minority groups, requires prevention, treatment, recovery, and harm reduction efforts that are tailored to promote optimal health for all. Arlene Ocampo, Washington, D.C., Eagle News, we live in extraordinary times.
Meanwhile, in another report released by the CDC, antimicrobial-resistant infections in the country have also increased during the first year of the COVID-19 pandemic. Rochelle Feria has the details.
A report from the Centers for Disease Control and Prevention, or CDC, concludes that the threat of antimicrobial-resistant infections in the United States has worsened. Resistant hospital-onset infections and deaths both increased at least 15% during the first year of the pandemic. In the report, CDC analyzes the state of antimicrobial resistance in the country immediately following the 2020 peaks of the COVID-19 pandemic. The data show an alarming increase in resistant infections starting during hospitalization, growing an overall 15% from 2019 to 2020 among 7 pathogens. During the first year of the pandemic, close to 30,000 people died from antimicrobial-resistant infections commonly associated with healthcare. Of these, nearly 40% got the infection while they were in the hospital. The CDC estimates that more than 2.8 million antimicrobial-resistant infections occur in the U.S. each year, with more than 35,000 people dying as a result. The CDC says the setback can and must be temporary. The health agency warns, however, that the COVID-19 pandemic has unmistakably shown that antimicrobial resistance will not stop if people let down their guard. Rochelle Feria, Washington, D.C., Eagle News. We live in extraordinary times.
Against the backdrop of predictions of a recession in the U.S., the country's unemployment rate remains at a 50-year low. Eli Austria tells us in the month of June, employers added 372,000 jobs to maintain the unemployment rate at 3.6% for the 4th straight month.
For those looking for work, these are good times. Lots of jobs are available. For some employers, though, it is a challenging time because of a shortage of workers with the skill sets they are looking for. In the healthcare and social assistance sectors, for example, there is a shortage of about 200,000 qualified workers. Sectors that showed hiring gains included the leisure and hospitality industries, food services, warehousing, and manufacturing. COVID-19 looms in the background, with nearly 4 million people deciding not to go to work because of the fear of becoming infected. Others opted to stay home to take care of at-risk family members. How long will the hiring binge continue? With inflation topping 9% in June, employers may start putting the brakes on hiring to protect their profit margins. As well, demand for goods and services may drop as prices continue to climb. And for those borrowing money, next month could see another big jump in interest rates, perhaps as much as 0.75%. Bottom line, even if you are employed, it's going to cost you more to live. Eli Austria, Los Angeles, California, Eagle News, we live in extraordinary times.
Facing another wave of COVID-19 infections, the province of Ontario in Canada expands its 4th COVID vaccine eligibility to people 18 years and older. In Toronto, Joshua Santillana reports.
Ontario has recently expanded 4th dose eligibility for the COVID-19 vaccine amidst Canada's 7th wave of the virus brought about by Omicron BA.5. Those 18 years old and above are now eligible to receive their 2nd booster shot. Those eligible are allowed to receive their 2nd booster shot if it has been 5 months since their previous date of vaccination and at least 3 months since a COVID infection. Dr. Kieran Moore, Ontario's top doctor, announces that a new combined vaccine may be eligible in the fall. This vaccine would contain 2 strains of the virus, which can be more effective dose against newer strands of COVID-19. Putting emphasis on the current presence of the 7th wave, Moore clarifies that PCR testing case counts are not representative of the actual case count and should be seen as 3 or 4 times more than projected. Currently, PCR testing suggests that there are over 15,000 cases in Ontario from the past week. Accurate case counts can be expected to be multiplied 3 or 4 times that number. Joshua Santillana, Eagle News, Toronto, Ontario. We live in extraordinary times.
3 weeks and counting, thousands of protesters in Panama are not letting up. After rejecting a deal offered by the government, demonstrators are saying their fight against the rising cost of fuel continues. In Ciudad de Panama, Sean Davila tells us how the largest protests in the country in years are affecting households there. Here's Window to Latin America.
Here in Ciudad de Panama, the capital city, access roads have been blocked by ongoing protests against skyrocketing fuel prices. Delivery trucks that supply supermarkets with food and other items cannot come through, leaving shelves in local groceries empty of basic necessities. Residents rely on what's left in their pantries, such as canned goods and grains, and if lucky, frozen meat and vegetables. After rejecting the deal offered by the Panamanian government, a compromise between the protesters and the administration remains elusive.
Sean Davila, Ciudad de Panama, Eagle News. We live in extraordinary times.
Now, this week's Health is Wealth. Findings by a recent study show that only 7% of American adults have good cardiometabolic health. Physician David Oria in Baltimore tells us what the research team has discovered using different factors affecting heart disease and metabolic disorders.
A research team out of Tufts University examined cardiometabolic health trends and disparities among Americans. The study examined 5 different factors including blood pressure, blood sugar, cholesterol, obesity, and presence or absence of cardiovascular disease such as heart attacks and strokes. The results they found were striking. The researchers found that only 6.8% of US adults had optimal levels of all 5 components. The team also identified large health disparities between people of different sexes, ages, races, ethnicities, and education levels.
As inflation severely impacts homes across the world, access to nutritious foods is becoming more and more difficult, even here in the US. What are some of the available options to somehow alleviate this burden?
Thankfully, there has been an increased effort to actively find solutions to this growing problem. Some include interventions such as the Food is Medicine initiative, which aims to use good nutrition to help prevent and treat illness. Also, there are incentives and subsidies to make healthy food more affordable, increase consumer education on healthy diets, and assist private sector engagement to drive a healthier and more equitable food system.
Avoiding what is called the summer slide, or the tendency for students, especially those from low-income families, to lose some of the achievement gains they made during the previous school year, the District of Columbia wants kids and parents to check out and take advantage of its Discover Summer program. Here's Jessica Bautista on Learning Curve.
Families of the U.S. Capitol are encouraged to take advantage of the DC Public Library or DCPL's Discover Summer program. The program includes free museum days and other opportunities to learn at home and in the community. Mayor of DC Muriel Bouncer says in DC, residents are surrounded with opportunities to learn. She encourages especially the young to take advantage of these opportunities. She reminds residents that aside from all the free museums that the district has, the library is also free. The Discover Summer program promotes reading and exploration of DC using activities involving different literacy forms. The program highlights the importance of daily reading and learning to prevent what is called the summer slide, particularly for the youngest learners. Through August 31, participants are asked to complete at least 4 activities a month. Since Discover Summer's launch in late May, more than 1,200 adults and 2,200 kids have signed up. More than 3,100 activities have been logged.
For the schedule of Discover Summer Museum Days, information about prizes families can win, and to learn more about Discover Summer and the visiting times at participating libraries, visit your neighborhood library or dclibrary.org/discoversummer. Jessica Bautista, Washington, D.C. Eagle News. We live in extraordinary times.
In honor of National Minority Health Awareness Month, a nonprofit group in Corpus Christi, Texas, hosts a public talk about how cultural identity can also impact mental health. Jane Kathleen Gregorio on community care.
While the subject of mental illness, depression, and suicide can be uncomfortable for some people, a nonprofit group in Corpus Christi, Texas, is opening the conversation to help those in need find the treatment they deserve. In honor of Minority Mental Health Awareness Month, the National Alliance on Mental Illness, Nami Greater Corpus Christi, recently hosted a public talk on how culture and identity intersects with mental health. The panel consisted of community leaders and professionals from different cultural backgrounds as they shared their personal struggles as well as ideas for solutions.
Major disparities exist in mental health care when it comes to minorities. There are many barriers that keep people from seeking care, such as language differences, diverse cultural perceptions about mental illness, also known as stigma, racism, vulnerability to being uninsured, and mistrust in doctors. So when a mental health professional understands the role that cultural differences play in the diagnosis of a condition and incorporates cultural needs and differences into a person's care, it significantly improves outcomes.
It was an honor being a panelist speaker today because I felt like it was a breakthrough in our community for the different organizations, because I do represent multiple organizations. So many people here today did not know about the different organizations, and now they leave here knowing that there is help out there for them.
An event like this really is reflective of the different minority groups we have here in Corpus Christi and the Coastal Bend. So tonight's event is really a way to showcase and highlight some of these different ethnicities and different minority groups, and how everyone views mental health and mental health awareness differently, and how we can all come together. And when we do come together, we all learn from one another. We all learn how to approach it. We all learn how to find resources together. And by working together, everyone wins in the end.
As a minority myself, I am of Filipino descent. I am an immigrant that relocated here or moved here in 1965. I was 4 years old, and I was happy to represent my heritage, my culture. As you can see, my jacket. Mental health affects everyone, and coming together to talk about it and having an open discussion where you are not afraid to express what is happening, that is a good thing, not only for your well-being, but for the community that you live in.
Jane Kathleen Gregorio, Eagle News, Corpus Christi, Texas. We live in extraordinary times.
Admirers of ceramic art in Townsville, Queensland, in Australia, get a front row view of the latest pottery creations by artists Catherine and Warren Ogden. Here's Morgan Goodfellow on Oceania at a glance.
The Townsville Studio of Contemporary Arts is home to many well-renowned artists. Catherine and Warren Ogden are no exception as they present their exhibition here today, Presence.
Catherine Ogden is a potter and artist based in Townsville. She holds a diploma of visual art from the Barrier Reef Institute of TAFE and has participated in masterclass workshops with other prestigious ceramic artists. Warren Ogden is a largely self-taught and experimental potter who has been working with clay for over a decade. His ceramic vessels draw influence from ancient pottery, including Japanese pots and wood-fired pots. Catherine and Warren Ogden's latest body of functional and figurative ceramic works engage viewers with a sense of time, process, history, and alchemy. The calm state of the exhibition commands the space, carrying the histories of the work's creation and materiality.
Morgan Goodfellow, Townsville, Australia, Australia at a glance, Eagle News.
Before we let you go, Arnie Aquino of Glow Up has some tips on how to make those eyes shine a little bit more. Arnie?
Hi friends, I'm back. My name is Arnie. I'm going to be doing another makeup tutorial for you guys. I'm going to be using this makeup palette. Today we're actually going to do our eyeshadow. This is going to be a really basic eyeshadow tutorial. So let's get started. I'm just going to be using one brush today, and I'm going to take that fluffy end of that brush and take some of that setting powder. This is actually a vanilla dust setting powder. It's a neutral color. I'm just going to put that all over my eyelids. I'm going to be using this color right here. I'm just going to put that all over my eyelids. The trick is to put that right underneath your eyes as well. That's my first color. Now I'm going to take this darker, it's more like a mauve color. I'm just going to put that like where I have my crease. This is going to give us the illusion of a deeper crease. Okay, now we're done. I'm going to use a smaller end, take a little bit of that, and put it again, like just on the outer corner of my eyes. Okay, this is a two-tone eyeshadow. This is a nice everyday look, and this is what it looks like. What I'm gonna do next, and this is up to you, but I like to put a little bit of shimmer, make my eyeshadow a little bit more fun. I'm gonna take like a finger, put it on a shimmer eyeshadow, and I'm gonna put that right in the middle, like towards the inner corner of my eyes. I'm gonna take a brush and clean out like underneath my eyes where I have that fallout. There we go. This is the final look, and you can see the shimmer really just brightened up the eyes. Hope you guys enjoyed this tutorial, and I will see you next time. Bye!
And thank you all for joining us again. If there are stories or topics you want us to share with you, just comment below. View, like, share our other shows. City Limits with Alan Basalyahe. Connected with Dr. David. Take a seat and join us with Anna Kui. Plate Date with Mike Hudson and friends. I'm also his friend, by the way. Plus, Journey, Stories of Filipinos in Canada with Kathleen, always my favorite last name, Cruz. Follow us on YouTube, Facebook, and Twitter at Eagle News Live. I'm Ken Cruz. Happy weekend, everyone.